The question is about the use of a defibrillator. They are wondering where the pads we use on the chest for delivering electrical shocks can be placed. You've seen, right, that there are pads that indicate where to place them. When a patient has a heart rhythm disturbance and is unconscious with no pulse, we perform chest compressions. It's important to use a defibrillator, whether it's an automatic defibrillator, AED, or a manual one used by doctors. We place one pad on the right side of the chest, just below the collarbone, and we find the collarbone first. Then we place the pad that says to be positioned under the right collarbone, which is near the chest area. The other pad is placed on the left side, just below the nipple, which will also indicate AED. When we press the shock button, the electrical current will flow between the two pads, passing through the heart, which ensures that the defibrillation is successful. It has been found that when a patient experiences a fluttering heart, some patients may have conditions such as myocardial ischemia. The heart may be fluttering, which is referred to as ventricular fibrillation. The term ventricular refers to the lower chambers of the heart, and fibrillation means a chaotic rhythm. Sometimes it may also be something called ventricular tachycardia, VT, which means the heart is beating very fast. When the heart is fluttering or beating very quickly, the problem is that blood cannot be pumped out of the heart, leading to a lack of blood supply to the brain, and the heart may stop beating. The treatment involves performing CPR, which is correct, and we also need to use defibrillation to reset the heart rhythm back to normal. The placement of the pads is also important. In this image, I believe the first pad on the left side is placed under the left nipple, which is the correct position. This position is labeled as apex. The other pad is located at the upper right position, right. However, some people have asked me if it is okay to place one pad under the left nipple as usual and the other pad on the stomach instead. This is not advisable, as this method may not be effective since the other pad is on the stomach. It is sometimes asked why we need to avoid certain placements. There may be a feeling that if we encounter a situation where a patient has a wound, such as a large laceration on the right side of the head, we should be cautious. For instance, if we place another pad on the right side of the chest, just below the collarbone, we might worry that if the patient has a significant wound there, like a large tear with bleeding, and the heart has stopped, we could face issues. Sometimes we attach pads to monitor the heart's rhythm, known as red dots, which are round stickers placed on the chest. If we attach 3 or 5 stickers and connect them to the heart monitor, there might be metal components in those stickers. If we place a pad on the right side and then press the shock button, we might risk shorting out something. Therefore, we avoid this method. I want to explain why understanding how electricity flows and how the device works is crucial. The electricity won't pass through the heart at all. If we place the pads on the abdomen, the electricity won't reach the heart, so it won't be able to shock the heart. If we don't understand the mechanism, we might think it's like being electrocuted. Have you ever seen someone get electrocuted? Or have you experienced it yourself? It affects the whole body. If you get jolted on a power pole, it affects your entire body, and you might think you can place the pads anywhere on the left, right, or abdomen, but that's not true. The device is designed to limit the electrical current because if we were to shock the whole body to reach the heart, the electrical energy would be very high, which we need to limit. Therefore, the pads must be placed correctly. In this image, I'm pointing out that the pad should be placed on the right side of the chest, right below the collarbone. If we place it there, the current will flow directly to the heart. If we place it incorrectly, the electricity won't pass through the heart. It will go through the abdomen instead, wasting a lot of energy. If the positioning is not appropriate, it won't help at all. Let me show you another image to illustrate the correct positioning. This is a method used by doctors, which involves placing hands on the chest of the patient, but if it's for public use, it will be a device called an AED. The automated external defibrillator AED has adhesive pads that we place on the chest, and the stickers have clear images showing where to attach them, indicating left and right with cartoon illustrations. The general public can simply look at the cartoon to see where to place the pads before peeling off the stickers. For the right side, we find the right clavicle and place the pad just below the clavicle near the area of the sternum. If you are a doctor, you would use the same method. This is the correct placement that is recommended. Now we place the pad on the right side of the patient. We locate the right clavicle and then place the pad just below it, slightly lower than the clavicle. For the other pad, we will attach it to the left side. There is a question that I often get. Some patients may have a pacemaker implanted in their chest. Some patients are older and their hearts. It's a bit challenging, but the doctor will have a device to implant under the skin to make the heart beat faster and return to a normal rhythm, which is called a pacemaker. Generally, pacemakers are not placed on the right side. They are mostly implanted on the left side. In this scenario, let's assume the patient has a pacemaker or a heart stimulator located on the right side, and their heart has stopped beating. We need to perform CPR and may need to use electrical shocks. Can we place the pads directly over the pacemaker? The answer is no. If we place anything directly on it, it could damage the pacemaker because the electrical shock would affect it. Additionally, energy can be lost. We deliver a shock to the patient with 200 joules of energy, but some of that energy is lost to the metal of the pacemaker, which is made of steel, so the shock may not be effective. Therefore, we should slightly adjust the position. We can still place the pad on the right side, but we should not overlap them. Keep them about an inch apart if possible. In this illustration, you can see that one pad is on the right side, labeled sternum, and it is placed above the clavicle. We find the clavicle and place another pad just below it on the right side. On the left side, we place the pad at the location called the apex. I will show you the direction. The electrical current will pass through the heart, which is located in the center of the chest. Some people may feel that the heart is on the left side. Position it in the center but slightly to the left. We plan to try this out. The direction of the electrical current, which we will call a vector, will pass through the heart perfectly for the electrical shock. There are two modes for delivering the shock, biphasic and monophasic. Generally, we use what is called biphasic. In biphasic mode, when you press the shock button once, the electrical current will flow from one pad to the other, but it will go back and forth twice, which makes the shock more effective and requires less energy. If anyone remembers from previous learning, we used to use monophasic, which required 360 joules because the current only flows in one direction, so we needed a lot of electrical energy to deliver the shock effectively. However, currently the device is biphasic, meaning it delivers one shock and then automatically returns, which reduces the energy needed to just 200 joules. I will show you the direction of the current. Now let's observe the direction of the current. This device operates in biphasic mode, and you can see that the current flows from one pad to the other. The electricity acts like a lure. It flows through and then returns to the other pad, passing through the heart perfectly. This is the appropriate method. However, in the first image, which shows the pads being placed on the abdomen instead, you can see that the direction does not pass through the heart, but rather through the intestines. Therefore, the electrical shock was unsuccessful. This is basic knowledge that rescuers need to understand. Those who assist patients must realize that the pads need to be placed in this direction. In reality, there are other placement directions as well, which are found in research, such as placing pads on the front and back. They would use the right pad on the upper part and place it in the center of the chest, while the other pad on the left would be placed on the back. This method can be done, but it may need to be performed by a specialist doctor, as it is still at the research level. Next time, I will discuss this in more detail. There is also a method of using 4 pads, which means placing the traditional right and left pads and then using another device to place pads on the front and back, called double sequence double second deviation, which involves delivering 2 electrical shocks at once. We will cover that next time, but at the basic level, we need to understand that it is still recommended to place the pads in this manner. So you place one on the upper right side and the other on the lower left side. This is the standard. I want to show you something. There's another question someone had about the pads. You see, on this machine, the pad that is placed on the chest is labeled sternum, but it's not actually placed on the sternum. What is the sternum? It's the bone in the center of the chest, referred to as the sternum. or the bone right above the xiphoid process. The xiphoid process is the bone in the chest, where we place our hands for chest compressions. The position is on the chest, which has bones. The other pad is called the defibrillator pad, or shock pad. That pad is labeled, and I don't understand why they wrote sternum. However, when we place it, we don't put it directly on the sternum. We place it on the upper right area, which means we find the clavicle, right? Then just below the clavicle, we place the pad. The other one is labeled apex, which is located at the tip of the heart, on the left side, right below where the heart apex is. I'm sharing this because beginners might think it should be directly on the sternum as written, but in reality, it's not. This is something people have asked me, so I'm illustrating it for you. This content is related to medical information, so for anyone interested, you may need to consult a doctor for more details. This content is for educational purposes only. I'm trying to draw and explain that if we understand the basics of using the heart defibrillator, it will be beneficial and help patients a lot. In summary, the placement has specific positions. Specifically, for those of us who are basic users and not doctors or researchers, we should not move the positions of the pads. We shouldn't just place them wherever we think they should go. It's not like an electric shock where touching it can shock the whole body. The device is specifically designed to deliver shocks to the heart only. Therefore, the direction of placement is very important. If we look at the patient and think about where the heart is, it is located in the center. We should place one pad on the right side, remembering to find the area near the clavicle, and place the other pad on the left side of the chest, just below the nipple. For the general public who are not medical personnel or basic life support providers using an AED, they should follow the instructions attached to the device. I hope this information is somewhat helpful.